Types of disc herniation. Disc herniation is usually classified in three ways. The first is based on morphology, and it divides herniated disc into protrusion and extrusion. Sequestration and migrations are subtypes of extruded discs. Based on location, disc herniation is classified as central, paracentral or posterolateral, foraminal, and extraforaminal. Based on containment, disc herniation is classified as contained and uncontained disc herniation. Now, the terms used in disc herniation can be confusing due to lack of standardization. To circumvent these problems, a combined task force of the North American Spine Society, the American Society of Spine Radiology, and the American Society of Neuroradiology in 2001 came up with some recommendations which were revised in 2014. So let us see how they define the different terms. A normal disc is composed of a central nucleus pulposus and a peripheral annulus fibrosus. A normal disc is contained within the boundaries of the disc space. So what are the boundaries of a normal disc space? Cranially and caudally, it is bounded by the vertebral body end plates. And peripherally, it is bounded by the outer edges of the ring apophysis, excluding the osteophytes. A herniated disc is a localized or focal displacement of the disc material beyond the limits of the intervertebral disc space. A localized or focal herniation means less than 25% of the disc circumference is involved. So, to summarize, if there is a displacement of the disc material beyond the intervertebral disc space, which involves less than 25% of the disc circumference, this is known as a herniated disc. The disc material may be nucleus pulposus, cartilage, fragmented apophyseal bone, annular tissue, or any combination. Thus, the older term herniated nucleus pulposus is not accurate, as material other than the nucleus may also be present in the herniated disc. What is a disc bulge? The presence of disc tissue extending beyond the edges of the ring apophysis throughout the circumference of the disc. So, if the displacement is circumferential and it involves more than 25% of the circumference of the disc, it is not considered as a disc herniation. If the entire circumference is involved, it is known as a disc bulge. This is not considered a form of disc herniation. If there is a asymmetric bulging of the disc which involves greater than 25% of the circumference, this is also not considered a disc herniation, as it is usually an adaptive change secondary to an adjacent deformity. Coming to the term broad-based disc herniation. This was used in the older definition and was a form of localized herniation. When used, it means a bulging of disc which involves 25 to 50% of the disc circumference. Coming to the morphological classification. There are two types, protrusion and extrusion. To understand the difference between these two, we have to understand two distances. First is the base. Base is the width of the disc material at the outer margin of the disc. And second is the maximal distance between the edges of the disc herniation in any plane. So, if the base is larger, as in here, than the maximal distance between the edges of the disc herniation in any plane, then it is a protrusion. However, if the base is smaller and the maximal distance between the edges of the herniated part is more, then it is a disc extrusion. Another definition that is sometimes used is that in a protruded disc, the herniated part will be covered at least in some part by the annulus fibers. A little bit of annulus is always left. Whereas in an extrusion, it will be completely out of the annulus and there will be no covering of annulus. So in protrusion, there is an intact or partial annular defect, whereas in extrusion, there is a complete annular defect. So both definitions are used in different places. What is a sequestered disc? It is a type of extruded disc. When the displaced disc material has lost continuity with the parent disc, it is known as sequestered disc. And migrated disc is displacement of the disc material away from the site of extrusion. Now this migrated disc may or may not be sequestered. Like in the above picture, it is also migrated, however it is sequestered, but here there is a migration without sequestration. Sometimes the disc may also migrate cranially or caudally through the vertebral end plates, forming nodes, and these are known as Schmall's nodes. Based on containment, herniated disc is classified as contained and uncontained. Contained is when the herniated portion of the disc is covered by either annulus or posterior longitudinal ligament. Whereas if it is not covered either by annulus or posterior longitudinal ligament, it is an uncontained disc. Based on location, we have two systems of classification: the traditional system and the system given by the recommendation committee, which we talked about. The traditional one is commonly used, so we must know it. It divides based on location in the axial plane into a central, paracentral or posterolateral, foraminal, and extraforaminal types. A central herniation is a herniation through the dead center. It is less common due to a strong posterior longitudinal ligament in this area. The most common symptoms in this type of herniation is back pain. However, severe compression can lead to the compression of the cauda equina nerve roots, leading to a cauda equina syndrome. The paracentral type is also known as posterolateral type. It is the most common and it is herniation between the center and the foramen. Because the PLL is weakest in this region, this is the most common type of disc herniation. Here the traversing nerve root is involved, which is the lower nerve root at the disc level. So at L4, L5 disc level, it is the L5 nerve root which is involved. Foraminal disc herniation is less common. It is at the foraminal level. Here the exiting nerve root is involved. Exiting nerve root is the upper nerve root in the lumbar level. So at L4, L5 level, the L4 nerve root is the exiting nerve root. Extraforaminal is lateral to the foramen, which is least common, and here also the exiting nerve root is involved. Now coming to the recommendations of the committee we discussed above, they divide the axial plane into 4 zones. The first zone is between the medial border of the articular facet on both sides, also corresponds to the lateral borders of the dural sac. This zone is known as the central canal zone. The next zone is from the medial border of the articular facet to the medial border of the pedicle and is known as the subarticular zone. The next zone is between the medial border of the pedicle and the lateral border of the pedicle and is known as the foraminal zone, and lateral to it is the extraforaminal zone. According to them, the discs are classified as central discs if it is in the dead center. A slightly asymmetrical disc to one side, however still present in the central canal zone, is classified as right or left central disc depending on the side it is herniating more. If it herniates to the subarticular zone, it is called as a subarticular disc herniation. Similarly to the foraminal zone, it is called a foraminal disc herniation, and extraforaminal zone is the extraforaminal disc herniation. In the vertical plane, the space between the lower border of the disc space and the upper border of the disc space is known as the discal zone. From upper border of the disc space to the inferior border of the pedicle is the infrapedicular zone. From inferior border of the pedicle to the superior border of the pedicle is the pedicular zone, and from the superior border of the pedicle to the inferior margin of the disc space is the suprapedicular zone. So this was a discussion on the types of disc herniation. This is a very important topic for postgraduates and also for neurosurgery residents. If you like these videos, please hit the like button and subscribe to the channel for more videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.